The lungs are made up of how many lobes? Upper, middle, and lower. Superior, upper, middle, and okay. So technically it's 3. So I'm gonna. Oh, that's not an option. Great. So do they mean all together? Because then I'm gonna go with 5. Yeah. Cool. You arrive on scene to a car accident and are treating a 35-year-old patient. He is unresponsive and not breathing. You should open his airway by... Okay, remember, it's a car accident, so you can't do the head tilt chin lift because you don't know if there's any trauma, so you're going to want to do the jaw thrust. Okay, doing the jaw thrust is the first answer. Doing a head tilt chin lift, definitely not. Opening his mouth wide while slightly hyperextending his neck, never, because he was just in a car accident. And placing a cervical collar and then doing a head tilt chin lift. Cervical collar is yes, but after you've done everything else. So you're going to want to do the jaw thrust maneuver. Yeah. You have a patient who has a history of asthma and is having shortness of breath. The patient has a doctor's prescription to take 4 puffs of an albuterol MDI every 4 hours as needed. Your local EMS policies allow you to help a patient self-administer the MDI. What side effects should you watch from the MDI? Well, like I said, family of asthma, so I definitely know they don't vomit. They don't get sleepy at all. They actually get agitated. Bradycardia, no, because everything actually opens, so like, well, regardless, it's increased heart rate. You have an unresponsive patient with an intact gag reflex. You attempt to place a nasal airway in the right nostril, but you meet resistance and you cannot insert. You should try a smaller size. I'd go with that one. Switch to an oral airway. No, because the person has a gag reflex. Push it in with more force. Absolutely not. Try the other nostril and be sure you have a lubricated device. I'm going with, okay, it's either between try a smaller size and try the other nostril. But if you do a smaller size, it might go in, but he's probably not going to get as much oxygen. Try the other nostril and make sure you have but you want 2 of them. So I'm going to go try a smaller size, because then it'll go in both of them instead of just one. That isn't correct. So we're most likely going to have to do try the other nostril. And let's read why. You do not want to use the wrong size airway or it will not be effective. Okay, that makes sense. Like I said, never force the airway in. An oral airway will not be tolerated. Okay, everything I said was true, but apparently, like, I still missed the question. You're treating an adult patient who is wearing a non-rebreather. The reservoir bag collapsed on inspiration. What actions did you take? Usually if that happens, it's because the flow of oxygen isn't as strong. So let's see the answers. Make sure the bag is connected to an O2 source and the flow is at least 10 liters per minute. That is, I agree. Tell the patient to take deeper breaths and blow out harder. No. Switch to nasal cannula. Absolutely not. Tell the patient to no. So it's definitely the first one. Symptoms of asthma most often include urine again, vomiting, confusion, no, wheezing, shortness of breath, and coughing every day in my household, fever and runny nose, that's just her allergies, and headaches, she just could say. I'm talking about my mom, by the way. Wheezing, shortness of breath, and coughing. 21, how many questions are on this? Okay, the upper airway does not include which of the following? The jaw, the larynx, the tongue, the trachea. I'm going to say the jaw because the jaw really has absolutely nothing to do with breathing compared to the rest of everything. It's incorrect. Oh, trachea is right. Where is the trachea? Right here. That's part of the lower airway. See, that was a silly mistake. Silly mistake. Silly mistake. Trachea. That can, like I said, I just gotta read more. Take your time doing this because you saw how I rushed and I got it wrong. Okay. The lobes of the lungs are made up of millions of alveoli, which are tiny little air sacs. What purpose do the alveoli serve? Before reading the answers, I just remember the alveoli is where there's gas exchange. That's all I can remember, actually. Okay, let's go. An exchange between oxygen and carbon monoxide occur in the alveoli. I think that's right. Wait, not carbon monoxide, it's carbon dioxide, so almost got that wrong. This is where the gas exchange between oxygen and carbon dioxide occurs. Yes. The alveoli exchange oxygen and nitrogen. Nope. It's this one. Cool. You arrive on a scene and find a 46-year-old male with difficulty breathing, an altered level of consciousness. He's I can't say that word, so I'm not even gonna try. Pale, diaphoretic, and has tachycardia. What are your patient's respirations per minute? Okay, well, since everything is, like, high, I'm assuming he's, like, breathing fast. Wait, it says right here, difficulty breathing. I'm so... So he's definitely not breathing fast. So I'm gonna go with 12 to 15, because that's the lowest. No, why not? Oh, okay, so if you're breathing, like, having trouble breathing, you're gonna breathe a lot faster. So that's where I was going the first time, that everything else is fast, so he's probably, like hyperventilating. So, greater than 20, let's try that one. That is correct. Cool. Right. Oh, so the word that I couldn't pronounce, anything greater than 20 is considered tachypnea. Your patient is a 32-year-old female who is unconscious without a gag reflex. You ask your partner to hand you an oropharyngeal airway to assist with maintaining the patient's airway. How do you measure the correct size? I just remember it's like right here kind of thing. So let's see. Measure from one side of the patient's jaw to the other side. Well, it's not really jaw to jaw, so I don't know if that's right. Measure from the patient's earlobe to the tip of their nose. Measure from the patient's tip of their nose to the correct corner of their mouth. I don't know what that means. Measure the patient's earlobe or angle of the jaw to the corner of their mouth. I think it's that one. Yes. You are called to an assisted living facility where you find an 86-year-old male who is pulseless and apneic. If he's pulseless, CPR. Your partner starts compression. Wow, I'm just so... No, I'm kidding. Your partner starts compression while you manage the airway. You're ready to place an oropharyngeal airway and notice the patient has dentures that are firmly intact. What would you do before proceeding with the OPA? Well, if he has dentures and they're intact, does that mean, like, they don't come out? Because if they don't come out, you can't really do anything about it. But if they come out, then take them off. Okay. Place the OPA, then remove the dentures. Leave the dentures in place. Switch to nasal, no, remove the dentures. I'm going to go with place the OPA because that's first, and then remove the dentures. Let's go. What? Okay, so I'm guessing you remove the dentures first, right? Or you just leave them in place because they're fine. Oh my god. I gotta read the questions more. I literally said that in the beginning and I come, like, you see what I mean? I just, like, go over my head. Okay. Let's go. We're almost done. Your unit is dispatched to a private residence for a possible choking. You arrive on the scene and find a 4-year-old female who was pulled out of the pool by her father. He states she was underwater for a minute or two, and then she vomited a small amount when he pulled her out. There is remaining vomit in her mouth and airway. She is apneic. What is the maximum time you're allowed to suction your patients before oxygenating them? Well, she's 4, so it can't be more than 10 seconds, so I'm going to go with 10. That's correct. Your EMS unit is called to a private residence at 3 a.m. for difficulty breathing. Upon arrival, you're presented with a 2-year-old female who had a low-grade fever for the past 3 days. Her mother says the patient woke up with a seal bark cough and difficulty breathing. What is the best treatment for your patient? Administer bronchodilators and low-flow oxygen. I don't even know what that is. I mean, I know what it is, but I never heard of EMS using it. Not for EMT people anyway. So I don't think that's right. Administer children's cough syrup and oxygen via nasal cannula. No. If she's like barking, there's most likely something stuck up there. Withhold oxygen, never. Administer humidified oxygen. I actually don't know this one. Like, none of these answers seem right to me. Actually, no. Administer humidified oxygen seems right. I remember, I don't know who told me. It doesn't really matter, actually, but, like, I'm gonna go with this one. Yeah, that's correct. Cool. Okay, you and your partner are at the station when you hear a frantic knock on the front door. A man says his 3-year-old daughter is in his car back seat with a sudden onset of difficulty breathing, sore throat, and a high fever. As you approach the patient, you notice she is in the tripod position, which means she can't breathe well, or she's in pain, or all of the above. Okay, sorry. On her mom's lap. She looks very ill and is drooling. What problem do you suspect, and how do you treat her? Okay. Epiglottis. The best treatment is to treat the patient gently and do not cause them to cry. Transport in the supine position with high flow oxygen, if tolerated. Transport rapidly with lights and siren. I don't know about the supine. Usually it's like whatever feels more comfortable for them. And right now she's in tripod because that probably feels best for her. Okay, the second one is epiglottis. The best treatment is to treat the patient gently and do not cause them to cry. Transport in a position of comfort with high flow oxygen, yes, if tolerated. Transport rapidly but quietly so as not to alarm the child. I didn't think about that one, but I still think that one's right. Pneumonia, the best treatment is to administer oral fluids, high flow oxygen, and transport in a position of comfort. Or croup, the best treatment is to administer humidified oxygen, transport quickly. Oh, okay, yeah, okay, let's read why. The patient presents with the classic signs of symptoms of epiglottis. Maybe that's why I didn't know it. Sudden onset of difficulty breathing, sore throat, and high fever accompanied by the children. Patient looking very ill, treating dry position. Alright, cool. Does this say... Oh, it's a sore throat. Okay. 29. You are presented with a 3-year-old male who was witnessed by his babysitter pulling a small plastic toy in his mouth. When she tried to take it out, it got pushed farther down his airway. The patient is unconscious and coughing forcefully. What is the best course of action? Quickly administer 5 back blows, perform 5 abdominal thrusts, perform a finger sweep, encourage the child to continue coughing. If he's coughing, let him continue coughing. So I'm going to go with that one. Yeah, that is correct. I remember if they're choking and they can cough, don't do anything, just let them keep coughing. If they can't cough and they're still conscious, that's when you do the abdominal thrust. But if they're unconscious, choking, they probably can't breathe, so that's when you want to do everything else. You are a volunteer EMT alone on a scene of a vehicle accident and performing 1 rescue CPR on a 10-year-old male who was ejected from a vehicle traveling 70 miles per hour. What is the ratio of compressions to ventilations? 30 to 2, right? Yeah, 30 to 2. I pressed the wrong one. No, I meant to... Okay, 30 to 2. Ah, fudge! I pressed the wrong one. You guys saw that I wanted to do 30 to 2, but I accidentally pressed 30 to 1. Whatever. This is not really counted. Okay guys, I hope this helped you studying for your EMT. I just wanted to do this because when I was still taking the class, or even now as I'm studying, I don't really see a lot of videos like this. I hope you enjoyed mine and found mine entertaining, and I hope you got inspiration for some notes. I think my next notes are going to be cardio and whatnot, so stay tuned for that one. If you like this video, let me know. Give me a comment if you want. Give me a thumbs up, a like, and subscribe so you can see more videos in the future. Thank you so much for watching, guys. Bye!